When I talk about a lot of these issues in medicine, I base my opinions on what I've learned in the past in my profession. We talk about the need for inpatient services and we talk about the need for outpatient services. There is always a role for the hospital, that we cannot function without a hospital. But on the other hand, we with outpatient services, we are really trying to mitigate the upward migration into the inpatient setting. And we're also want, upon discharge, to provide a cohesive system for the patient to continue to exist in an outpatient setting and not repeat the cycle. So inpatient, if somebody has, for detox, for instance, we do ambulatory detox. Ambulatory detox is not for everybody. It's patient selection. We want to know what medical factors they have. If we're detoxing a alcoholic patient, we need to know, do they have a seizure history? Do they have cardiac issues? Do they have delirium tremens in their past? All of these things are really important because an outpatient has to be done with appropriate patient selection. If they're not a candidate for outpatient, then they go inpatient. However, that being said, a lot of patients are perfect candidates for outpatient detox. One of the things about outpatient is you go home to your family, you sleep in your own bed. We take care of the patient for about 6 hours a day. We have a fully stocked, pharmacy that's registered with the DEA. So we can give the same medications that, for the most part, that an inpatient facility can give. But on the other hand, the patient goes home. And that is inpatient detox where the door locks behind you can be really scary. And that might keep people out of the system. But if they're doing it in our system where they have somebody to go home to, they're properly selected, we're going to get the same results, not only in a more comfortable setting, but we're also going to get those results in a setting where it's more easily approachable. If the patient is going to be more likely to partake of this type of a situation. We're also open 7 days a week, so if a 5-day detox is necessary, 2 of those days could be on the weekend to lessen the requirements of having to be away from work. The other things that we do is we're very strong believers in, if the patient has a functional or even just a somewhat functional family that needs to be fixed in a lot of ways, and if they have a profession, we really think that patient should stay in that setting. I think if you have to go away for 30 days, if you have to go away for longer, some people do, and we're not fighting that. We understand that. But on the other hand, if you can keep people in life and educate them while they're in their present lives, I think they have a much greater chance of holding on to the things that they do have. So we want to provide something to people that have the ability to participate in a comprehensive outpatient program and still do the things that they need to do in their everyday life.